Your immune system works to keep your body safe and protect it from infections. It works against germs, which can cause infections and make you poorly. Your bone marrow is where your stem cells are made. Stem cells grow into blood cells and platelets, which keep you healthy. Sometimes your immune system accidentally starts to work against your bone marrow. This slows down the bone marrow and it can't make enough of the stem cells you need. When this happens, it's called aplastic anemia. To help with this, you might be given some medicines called immunosuppressants. Immunosuppressants quieten down your immune system to give your bone marrow time to recover and start making the stem cells you need. There are two main types of immunosuppressants: Ciclosporin and Anti-thymocyte globulin, or ATG. Cyclosporin is given as a tablet or as a liquid. It takes a while to work, so you might need to take it for 6 months or longer. Some children get shaky hands, swollen gums, and extra hair on their body when they start taking cyclosporin. These are called side effects. Not everyone gets these, and if you do, they won't last for very long. The doctors and nurses will keep checking you and will ask you to take more or less cyclosporin to help with this. ATG is given through your central line. Your central line allows you to receive medicine, fluids, blood, or nutrition through it. It can also be used to take blood. It takes up to a day for each dose of ATG to be given to you. You can read a book, watch a movie, or play on your games console to help you pass the time. You'll stay in hospital for a week or two after the ATG treatment, and someone will be with you during this time. Your doctor might suggest that the best treatment for you is a stem cell transplant. This is when a kind person called a donor gives you their stem cells. These stem cells are placed into your blood, where they make their way to the bone marrow and start to grow into blood cells. They need to be a good match for you, and there is a 1 in 4 chance your brother or sister could be a match. If you don't have a brother or sister, or if they are not a match, it could be another kind person who is a donor for you. Before your stem cell transplant, you will have a treatment called conditioning therapy. This takes about a week and is given through your central line. This helps to clear any poorly stem cells from your body and makes room for your new stem cells. The conditioning therapy can sometimes make you feel sick, tired, and a bit fed up. Keep telling your parents and the doctors and nurses who are taking care of you how you feel, so they can help you feel better. On transplant day, your stem cells are given to you through your central line. This takes up to a few hours. You are awake and it doesn't hurt. After your transplant, you'll spend a few weeks in isolation at the hospital. This is a germ-free room to keep you safe from infections. You can take some of your favourite things to make it homely, and someone will always stay with you. Conditioning therapy usually makes you lose your hair. You might find it easier to cut your hair before this happens. Remember, hair grows back, so try not to worry. When it's time to go home, you might feel really excited, or you might feel worried about leaving the hospital. Remember, your doctors will only say you can go home when you are ready, and you'll continue to see them at checkup appointments. To find out more about the different treatments, there is lots of information on the Marrow Kids website for you to look at and talk about with the grown-up.